And we're live again with the Boston Congress of Public Health, the 40 Under 40 Public Health Callus Awards. We have another guest with us today, Dr. Nida Ali. So, as you remember, the 40 Under 40 is a program that represents the next generation of leaders, entrepreneurs, researchers, scientists, activists, intellectual provocateurs, authors, and directors who are inspiring us and catalyzing us to a more just and equitable world. So, Dr. Nina Ali, we know a little bit about you. We know that you're a medical doctor, you're also a public health specialist, and that you've been focused on eradicating polio, amongst other things. But go ahead and tell us a little bit more about yourself, where you're calling in from right now, as well as some of the major projects you're working on.
Okay. Well, I basically hail from Pakistan. I was born there, raised there. I got my education, my medical education there. And I worked as a clinician, as a physician for 3 years, including in ERs. So after that, I joined Ministry of Population Welfare with their sexual and reproductive health program, and I stayed with them for 2.5 years until I joined World Health Organization Pakistan for their immunization program that was focused on polio eradication. So I worked there for 5.5 years, and I then came to Emory for my fellowship in global health. And right now, I'm working as a fellow with Task Force for Global Health, with Coalition for Global Hepatitis Elimination. So it's a mix of being a clinician and being a public health professional, but now I have found my passion in public health and particularly disease elimination and eradication. So I'll keep working on that for like a few more years now.
That's great, and I know I watched the video you had in terms of working with the WHO and eradicating polio. But what are beyond polio? What are some of the other diseases? I guess that you're looking towards, and kind of any interesting things that the audience can learn about in the process of getting vaccinations out there for different types of diseases.
Absolutely. Yeah, for first few years, our focus was polio eradication and our focus was polio immunization. But then we realized that we cannot eliminate polio alone unless there is general acceptance for vaccinations. So we started working on our routine immunization programs as well. So all children should receive other vaccinations, injectables, and oral vaccinations in addition to polio as well. So we were working on strengthening this basic structure, overall structure for vaccination. And because this structure was so strong, we were in a good place when we had to introduce and roll out COVID vaccines because there was a structure that was already available. There was HR that was already available. So we used that resource for rolling out COVID vaccine in our country. So this had dual benefits, and also all the advocacy work that we had done for other vaccines, it came in handy when COVID was rolled out in terms of health promotion and advocating for health equity and all of that. And now I'm focused on hepatitis elimination, which again, particularly hepatitis C, that can be eliminated. And by elimination, we mean we can reduce its transmission and we can actually bring the case count down to more than 90% because there is a cure available now.
This is all fascinating stuff. So I feel like you might be the perfect person to ask about, this. It's something that probably has existed for some time, but I think came more to, the world's consciousness. This notion of vaccine nationalism, especially during COVID-19, and whether or not countries should just be focused on themselves in terms of their own vaccination campaigns as opposed to sharing with other countries and helping other countries. Can you comment on, I guess, vaccine nationalism as it relates to COVID-19 or other things you've worked on?
Well, yeah. Uh, Nationalism, I don't understand it. There is another terminology called as viral sovereignty, and that includes that if some country detects a virus, they have a right to it. No other country can, use the genomic sequence to create vaccines and all of that. And as a public health professional, I never understood that concept. So there's a similar concept of vaccine nationalism, which doesn't make sense to me because if one person at one corner of the world is still suffering from a disease, he may as well be a source to transmitting this disease all across the planet, like we have seen with COVID. So, vaccinating only one part of the world or only your country doesn't mean that your country is safe from the disease. So, it has to be more generalized approach. We have to save other countries in order to save ourselves. And we have recently seen this with upsurge of polio cases in the countries that have been polio free for years. Like, if it persists in the planet in one place, it has all the right to travel across the planet without the passport and infect anybody. So, vaccines should be for everybody, not for just one nation. And of course, I would like to give the example of my own country. The first lot of vaccine that we received was a gift from China. And this was the vaccine that had been tried and tested, but the phase 4 trials that we call as post marketing surveillance, that wasn't done adequately. But then there was so much need in Pakistan for these vaccines and so much public demand that we actually opened our market to this vaccine, and the uptake of vaccine in initial days was very good, and there were no deaths or no dangerous side effects reported after COVID vaccination. So having China support us and opening our doors to let them have their vaccine out in the open for phase 4 trial, it was actually a benefit for our country. And on the other hand, I think about my friend in Bulgaria. They had vaccine supply of Pfizer lying in their stores, and they could not use them all up because there was so much public resistance for vaccination. And by the time they wanted to use the vaccine, it was approaching the expiration date, and they couldn't use it all. So there were some officials who suggested that instead of letting this vaccine expire, we should give them to the neighboring countries that are in need. And it was not allowed by their government, and there was a huge lot of vaccine that was expired. And we see the inequities. On the other hand, there are people who cannot get the vaccine, who cannot afford vaccine, who cannot access the vaccine. So this kind of disparity, being a public health professional, doesn't make sense to me. It's global health. We are global now, and the testing, the treatment, whatever resource we have, it should be available for everybody. Thank you.
Yeah, that is absolutely incredible. Like as you said, just the disparities that exist. The resistance that can exist in certain countries, right? And then like the absolute dire need in other countries. And then I just think about the money that it costs to produce these vaccinations, and yet with all of these political shenanigans, that we're losing, millions, if not billions of dollars through that whole process. But I digress a little bit. So I want to dig a little bit deeper into your public health journey. So you started out doing more clinical medicine and made that transition. Was there anything in your own personal history, your family's history, or like something that you experienced in life that prompted you towards the public health route?
Absolutely. Well, when I was doing clinical medicine, the very first department I joined was gastroenterology and hepatology. And by that time, my mother was actually suffering from hepatitis. And, there are still a million of people who are living with hepatitis C, and they are unaware of their infection. So my mother was in a similar situation. Like, she was suffering from hepatitis for a long, long time, but we were unaware because she was otherwise a very healthy woman. And the time when we got to know that she had hepatitis, it was way too late, and she had developed all the signs and symptoms of chronic liver disease. And let me tell you, her last days were not easy. So it was back in 2011. I was working in the Department of Gastroenterology and Hepatology, seeing all the patients suffering from hepatitis B and C, and coming to us with all the signs of a decompensated disease where there is very little that we can do for the patient except for providing supportive care. So I was doing the same thing in the hospital, and when I get back home, I have a very similar patient at my home who requires similar kind of treatment, and who needs the similar things. So, like, imagine I am doing a tap, ascitic tap for one person in the hospital, and then I'm coming home and doing the ascitic tap for my mother. So this gave me a little bit of compassion fatigue, and it kind of, got my threshold very low in terms of being able to see a very sick and dying patient. So, because with every patient, I was impacted on a personal level so much, I there was a point that I couldn't take it anymore. And Then I tried to work in gynecology and obs, but then again, there was this environment that didn't allow us to be very empathetic or compassionate with the person we are dealing with the patients, with women who are delivering or women who are coming to us with STDs. There's a lot of cultural factor to it as well. And right now, with the Supreme Court decision that was just recently done in US, it impacts women's health everywhere. So, like a combination of all these things. And when I joined the Ministry of Population Welfare Program for Sexual and Reproductive Health, we were dealing with clients there. They were not the sick people who were coming to us. It was mostly well women who used to come to us with their reproductive health needs or their contraceptive needs. So I found it to be less like I was. With my heart and my soul, I was not as much affected negatively by it as much as I was with sick people. So it was kind of my inability to withstand the sickness and the terminal illness anymore that got me interested towards public health, where I do not interact with such sick people every single day, but I still can make a difference in terms of saving lives using my clinical knowledge and background to apply it in public health and have a perspective that is very unique. Being a doctor and thinking about public health, it brings a unique combination and a unique way that I can think about stuff. Yeah.
I completely understand, what you're saying and where you're coming from, and it's a very unique route into public health. I just think about how other people go into it, other reasons why physicians go into it. For me, being in the field of neurosurgery, one thing that many people found either odd or laughable was like, well,
Mhm.
how do surgeons, interact with public health? And I'm like, well, it's a very underappreciated aspect. There are many things like neurosurgical diseases that can be prevented. People just aren't thinking about that. But just
Yeah.
related to what you were saying, I really feel for that whole journey of yours, and just the term compassion fatigue, I think is huge. I would say though, do you feel like it's still possible to get that compassion fatigue as a public health professional? Um, yeah.
Absolutely. You already know that polio campaigns are conducted door to door, and these are people who are working really, really, really hard, but for years. And for years, they have been doing the same thing over and over and over again. And we have made tremendous progress, but still, it's kind of a setback that we still get the cases popping up in the communities that are the most vulnerable and that we haven't penetrated enough. So, yes, when we are working that hard in the field for public health, it's very easy to have a burnout because it's very long hours, it's heat of the day, and it's, staying outside of the house in the field for extended hours and not seeing your families for days. So, yes, it entails some kind of burnout and some kinds of fatigue. Compassion fatigue, I am not sure about that. I do not have any personal experience with this, but yes, having a burnout when you are so deeply involved for a cause, it can be there. Yeah.
Yeah, I think that's important. I think you're probably the first interviewee, or we've talked about this sort of thing. A lot of our conversations have been very aspirational. Why people do what they do. Could I ask you to say, like, are there ways that yourself or some of your colleagues work to mitigate some of that burnout, given such a strong mission for public health, but then all of the issues that can impact those public health campaigns, besides politics and money and community resistance?
Yeah, absolutely. Just like the vulnerable communities, the very hardworking people who are in the field and who work in the field a lot, they form actual groups where they can, have little breaks, and they little breaks. By little breaks, I mean that maybe in their 12 hour of work, they can have half an hour to sit with each other and joke about stuff and share experiences what they encountered in the field. Because in the field, it's so diverse. You're going to people's doorsteps, and everybody behaves differently. So this group is like they have really refreshing discussions of what they found in the field, and they tend to get the humor out of it. So it's really the humor, the sense of being, sense of taking this very dark and gloomy thing that we are working for, the disease, preventing diseases, and then finding the humor in it somehow, having a very tough field and then still being able to joke about it. It's something that is very refreshing. So this humor is what I think keeps the field workers alive.
That's very interesting. And I just also like that. So you highlighted humor, but at the same time, I think you were talking about, community resilience, bringing together, being able to
Absolutely.
share those experiences, as well as not feeling like it's solely the burden on yourself. So I know that you've been involved in other humanitarian services. Is that correct?
Uh, my whole career is dedicated to public health. I don't know what you're particularly referring to.
Oh, absolutely, totally fine. Well, how about we switch to a lot of the things that you've done, I guess, in sexual and reproductive health, other programs you've led, et cetera. Can you tell us about those experiences, some of the interesting things within public health or kind of social justice issues that you may have encountered dealing with those topics?
Absolutely. So, when I started working for reproductive health in my country, again, I had the chance to interact with such diverse communities. Like, my personal circle was very privileged. There were privileged ladies who could get any kind of health service they needed. But when I joined this government sector and I saw the general public coming to it, I understood what their needs were. This was my first interaction with the general community who is seeking health in public sectors. So, the thing that I felt was lacking was health literacy. Literally, there were some women who had multiple children. They come to us and they do not know the difference between a vagina and a urethra. They think it's the same organ. So, to communicate to them in a language that they understand and to make them understand, okay, these are two separate organs and how to care for the health of these organs, it was a completely new experience for me. And then there are women who come to us, and when we are overburdened, we tend not to strike up a long conversation with them, or sometimes not even ask their names because we have patients, clients lined up to get their IUDs or to get their surgery for the contraceptive surgery, tubal ligation. So it was definitely a new experience for me. It was surreal, but on the other hand, it was kind of a wake up call at the same time to know that the inequities in health for women, they are everywhere. It's not just one country, it's not just one area, it's like everywhere. So there were women who were coming to us for post abortion care. And it's a funny thing that in my setup we were not allowed to perform abortions, but we were given the very strong training for post abortion care. Like, if a woman comes with abortion, we have to care for her. But if the woman comes to us and asks for a voluntary abortion, and as per our law, we are not allowed to do that. So at least we were able to provide post abortion care and save lives in that manner. So yeah, this is one side of public health. The other side of public health, and that has also something to deal with inequity, but and social justice. I was on a outbreak response mission at a remote area of Pakistan, and I was hovering around in the field trying to find more families, more children who need vaccination. And I approached this mother who was actually washing clothes at the bank of the river, and she had a few children playing by her side. So I went up to her, introduced myself, asked her for the introduction, and she told me she had five children. And what I came to know is that this community didn't have any concept of soap, so she was washing her clothes without soap. There was no concept of using soap after defecation, and for defecation it was just the open area. There were no toilets available. So I didn't really know how to communicate the message of vaccination to this mother for the diseases that her children have not yet had. And then I started to softly try to give her this message. And during our conversation, I also realized that she was worried about what she's going to feed her children the next day. She had resources for today, but she didn't know where she's going to manage to feed her children the next day. So, and then there was this little candle of compassion. And I started thinking, what if I am worried about, feeding my son for the next day? So, having my son vaccinated in this scenario, it will be the least of my priorities. So, thinking empathetically about that, I think this woman will never care about having her children vaccinated. She is always worried about where to feed them next.
Wow, that's a very powerful story. And just like the hierarchy of needs that as public health professionals, we may not always be as aware or vigilant to when, a policy is created, but yet when it's distributed, it doesn't reach people exactly the same way, right? Because their hierarchy of
Mhm.
needs are different. Mm. So let's switch a little bit. So you have been a Herbert Humphrey Fellow. Tell us a
Yeah.
little bit about that fellowship, some of the work that you've done with that.
Yeah, sure. So Hubert Humphrey Fellowship is a fellowship that is designed by U.S. Department of State for mid-career professionals, and they have a chance to come to the U.S., study here for a year, take courses, network, work for American organizations, and take all the best practices home. This is what the concept is. So I arrived here in August 2021, and I have spent this wonderful time here taking courses at Emory, working for CDC. I worked for CDC Division of Viral Hepatitis for 5 months, doing literature review for their hepatitis B vaccine. And then it was presented to ACIP, and there was this, like, not the vote, but there was this general agreement that, okay, this vaccine is approved by FDA, and we presented our findings to ACIP, so it was okay to use in adult population. And yeah, then I started working with Task Force for Global Health, Coalition for Global Hepatitis Elimination, which is also in Atlanta, Georgia. And this is also a wonderful project. We are interacting with different countries, and learning from best practices, developing new policies, how to have the momentum and the pace for eliminating hepatitis from the planet.
Wow, very interesting. Wanted to put a plug in there in case there are some listeners who are interested in that particular fellowship. So
Yeah.
let's segue again. You are a 40 under 40 BCPH Public Health Catalyst Award winner. Has
Yeah.
your life changed since the award, or has it stayed the same?
Yeah, well, first of all, it always feels wonderful to acknowledge, to have somebody acknowledge what we have done. And in terms of public health, this is not done very often. So I was really, I felt wonderful when it was my biography was there, the video was there, and I was acknowledged with all the other people from all very diverse. Set of background, and I read the profiles for all the other 40 under 40, and I saw what amazing work these people have done. So it's amazing. It feels amazing to be a part of this wonderful community of 40 people who are under 40 and who are such high achievers. So it's definitely something that I will cherish. And also, as soon as I updated this on my social media, there was a lot of support from my country, and people were actually sharing it further. And Hubert Humphrey Fellowship page actually tweeted it, and then Pakistan Embassy page tweeted it, and then today, U.S. Embassy Pakistan actually put this on their official Facebook page. So it feels wonderful, the ripple effect. And now I am being approached by so many aspiring mid-career professionals to help them with writing their essays and preparing them for interviews for the Hubert Humphrey Fellowship.
That is fantastic, and that I mean everything that you just mentioned were definitely the goals in our organization creating this program and being able to amplify the voices and the work of people like yourself. So that is fantastic to hear. I will ask you: do you, in the short term and the long term, what do you see? That might be possible for your cohort. As well as cohorts 40 under 40 Public Health Catalyst Award winners to come.
Well, I think if we keep track of the progress that each one of us is making, and then have this progress compared to where we are today, it will help us to gauge how much these people, these 40 people, have achieved in next 5 years, and how the BCPH has, through this recognition, helped them to advance further in their career, and how much people they have reached through BCPH and helped to grow further. So I think the impact is going way beyond this announcement or this feature at the BCPH. And I would love to see what the other fellows in the cohort are doing. And yeah, I would love to keep track, and I would love to share updates from wherever I am going in my career.
I think that sounds great. Yeah, and I love the idea, of keeping track of where you guys are, as you said, like 5 years, etc. one of our desires to be able to bring you all together, and it's difficult, right? You're all over the globe, but to be able to bring you together in one place to be able to actually interact. And it might just be something that we can do virtually at this point, but we'd love to do that in person. So, Dr. Nita, can you tell us, an inspiring moment you've had in your life and/or career?
An inspiring moment. Well, yeah, let me think about it. I'm sorry. Because one inspiring moment was meeting this mother who was there, and feeling, having this compassion, feeling that empathy, that what if I am in her situation, what would I do, how would I cope with all these things. So that was one very inspiring thing. And the other inspiring thing I remember was in the same part of Pakistan, and I was monitoring polio campaign there. And it was mid-July. It was very, very, very hot. And I approached this worker who was going door to door and vaccinating children. She was covered in a drape because this is what the cultural dress code there is. And she was carrying the vaccine carrier on her shoulder and carrying all the paperwork in her hand. And she was literally sweating from head to toe and still being able to welcome me as a monitor with a smile. And when I see these women, I feel something inside of me, and I feel like they are underpaid, and I feel like that they are our frontline heroes, and that we cannot ever pay them enough. Sorry, getting a little emotional.
No, I think that's great, and I think there has to be, that absolute appreciation of frontline workers, and not just those who are in clinical medicine, but those who are frontline in public health. So I
Yeah.
completely agree. And those are it's when I ask this question to people, their inspiring moments, I definitely have gotten a variety of answers, but I think even the smaller moments, you can have just beautiful, inspiring moments. I will switch and say, how about a challenging moment in your life and career that may have been transformational and helped you to become the person you are today?
Absolutely. Well, I was used to working in big cities. And when for this public health cause, I was sent to the areas that were not that big, that were remote. It was kind of like a cultural shock to me because uh, the public health was largely colonized by politicians. How the hirings were done, what resources are to be allocated, this was all done by politicians, and the public health professionals out in the field, they had very little impact on it. So the system as a whole, from top to bottom, was corrupted. And this led to, problems in service delivery and problems for reaching our goals. So I took my time to realize what was going on. I communicated with people and my colleagues and people in health department, and I came to know that they were all telling the truth. Because of political involvement, there was very little that they could do on their own. So I communicated all these matters to my superior officers, and we tried to make a difference by, gathering the community and gathering the community workers, the community health workforce at one place, and having them work despite the fact that they were not agreeing to work, being a part of that corrupt system. So that was a very challenging situation, but we were finally able to find people in the system who were ready to work. Despite having all the political background and all of that, but we had to explain to them what this cause means. We had to explain to them that their corruption can lead to so many deaths and paralyses. So there was this whole thing over time, or this whole rapport that we developed. We managed to, sit with them, eat with them, live with them, and then we were able to convince them how to, navigate through the system and protect children from these diseases that are very easily preventable. Only thing we need to do is to convince ourselves to actually work and not be influenced by all the politics that is going around in the health system, and to not let at least ourselves, our own causes, be colonized by all of these corruption and conflicts.
Yes, I think such an important point, that you make, the politicization of different healthcare issues, and obviously something we've seen very much
Yeah.
with COVID-19, in terms of, at least here in the U.S., those who who originally decided they wanted to get the vaccine versus those who didn't, and it became a matter of Democrat versus Republican or conservative versus liberal, as opposed to the science behind it.
Hmm.
Dr. Nita, in all the work that you've done in disease eradication, prevention, sexual and reproductive health, what do you think is missing, from the public health discourse, from your perspective, in the
Yeah.
U.S. or Pakistan or abroad?
Yeah, everywhere is the same story. We are not deeply rooted enough within the communities, because we have this notion when we are developing policies, we are sitting in air conditioned offices and we do not have any idea what the community needs. This is the worst thing that we can do as a public health professional. So once we go in the field, interact with the communities, we get to know their problems, and the community itself tells us what they need. The community itself trains us how to approach them. The community tells us how to talk to them, how to speak their language, how to get access in their households. So unless we interact with communities at their household, there is no way that we can develop the communication strategies, or actually just to coerce them to get vaccinated, or to say yes to the services that the government is offering. Now, we have to have the community centered approach, and not to go to the community with the notion of, I know what they need. We never know what they need. It's the community that will tell us.
Absolutely. I totally love that answer. And if you had a magic wand, and uh, you could have more resources, or something else in the work that you do, what would it be?
More resources in terms of, like, I don't really understand the question.
Well, that was an example, but if you had a magic wand, so a difficult,
Okay.
yeah, some difficulties that you may have had in your work. If you had a magic wand that could erase that difficulty, or mitigate against certain things, what would it be?
Well, we already have this magic formula right in front of us to invest in universal health coverage. Because if we are able to universally strengthen this healthcare, this primary and very basic healthcare system, all the major problems will be resolved. Like, we cannot be able to eradicate diabetes mellitus or cancer or hypertension. But again, in the realm of infectious diseases, if we have this strong healthcare system, this will benefit everybody. So, if I could have a magic wand, I would develop the actually universal healthcare coverage system that covers everything, every state, every country, every county, and people, everybody, regardless of their financial status, their religion, their race, they should have equal access to this healthcare system.
Wow, that is very awesome and very interesting. And I'm wondering, if you would ever be interested in writing up, say, a manifesto of what that might look like, especially if there's other people in the 40 under 40 cohort that might be interested. Which,
Sure.
you have so many different people with different backgrounds, from those that are entrepreneurs to the policymakers to those that are doing design, etc. You
Mhm.
never know what might come together. So, Dr. Nita, thank you so much for this awesome interview. For the audience who's listening, if you want to learn more about Dr. Nida Ali, please go to bcph.org 40 under 40, and you can find out more about her. If you're interested in more public health topics and other things on social justice, go to our journal, HPHR Journal, formerly known as the Harvard Public Health Review, at hphr.org. And thank you again so much for joining me, Dr. Nita, and we'll be sending off.
Yeah. Yeah. Great. Thank you.